My health was going in a terrible way. And when I read this book, it was like lights went on, music started playing. It was like, if I don't take ownership of where I'm headed, I'm going to end up exactly where I'm headed, which isn't a good space.
Hello, everybody, and welcome to Talking Health with Health Solutions, a brand new podcast that brings to you not only the behavioral, but also the physical side of health. This podcast is being brought to you by Health Solutions, a nonprofit organization that has been serving the Pueblo and surrounding areas for over 60 years. On today's episode, we have Heather Hankins, who is our Chief Clinical Officer. Thank you so much for being here, Heather.
Pleasure to be here. Thanks for having me.
This is Talking Health with Health Solutions, and we are your hosts, Melissa Ayala, the Director of Health Solutions Acute Treatment Unit and Crisis Stabilization Unit.
And I'm Nanci Gonzalez, a suicide prevention coordinator.
So today we're talking about some exciting news about Health Solutions. We've been in the news a little bit lately, which is exciting in a positive light, and we've earned some amazing awards with Best of Pueblo. We recently won, what is it, Heather? 6 different categories?
6 different categories, yeah.
That's amazing.
Absolutely.
So what has made Health Solutions such a strong community health leader year after year that we keep achieving these outstanding awards?
I think there's a multitude of answers to that question. One is we've been in the community for decades, and we're here and people trust us. Our staff are really who make us who we are, serving the community day in and day out. And we're really wherever people need us. We're in the schools, we're with law enforcement, we have open access where years ago we figured out that we really need to be here when people need us. And making an appointment and going through scheduling just wasn't working out as well as we hoped. So being open 8 to 5, Monday through Friday, and just when you're ready to come in, just come in. And that's just one of the options people have to come in. We also are in the community. We have outreach teams. And so being where people are and where people can reach us and come into services wherever, whenever, I think is a big part of what makes us great. I think also our ability to adjust to community needs. When we see a need in the community, we don't just stick within a box and say, okay, here's the door in. We have a multitude of services that we provide, and one of those services that we also won Best of Pueblo is the therapeutic preschool, and that started with COVID. Where we had staff come in and they were in tears because grandma was trying to get their child on Zoom meetings when, they can't figure out the remote versus the TV. And so that from there, we opened up child pods through the learning tree just for childcare for staff, for school-age children. And we hired certified teachers. We had enough space that they could be separated. And then from there, staff said, we really need all ages. It's like, okay. We'll do all ages except for infants. Like infants, that's scary.
Changing diapers.
Yeah. And it's an infant and it's scary and lots of regulations. Well, we have 3 infant rooms now.
Wow.
Because that was the need of the community and that was the need of our staff. You couldn't find spaces for infants. So that's a good example of how we were able to pivot and adjust to needs of not just our staff, but to the community.
Yeah. And that trust had already been built with the community to entrust with that small child infant that is your pride and joy to say, hey, I trust you. Please take care of my child for me, because we had already built that in the community.
Yeah, 100%. 100%.
I think that comes with all of the things that you mentioned, Heather, is that, we talk a lot about this in previous episodes, that I don't necessarily think the community knows of all of the things that Health Solutions has expanded to, because it started off as the behavioral health, but now it's so much more than that, right? It's so much more things that we offer. And I think with the things that you mentioned, it makes it a great place to work, which was one of the awards that we won is best place to work.
That's probably one of my most favorite awards is Best Place to Work, because that really tells you what's going on behind the scenes.
Right.
We believe in our people, and we know that if we take care of our people, they're going to take care of the community. So we offer a lot of different things. Childcare is huge, and super proud of that. We have tuition reimbursement. We have all sorts of different education and trainings that we provide to the staff. And we really invest in our leadership because we know that's the key in building trust and building a positive culture within the organization, and supporting our team and supporting our staff so that they have good quality of life at work and at home. And then that helps Pueblo not only survive, but really thrive. Our people are healing the community day in and day out, and we make sure that we take care of our staff.
Yeah, absolutely. Workplace culture is such an important aspect because people can work anywhere and people choose to work at Health Solutions. And you mentioned, like having leadership and making sure that leaders are grown within the organization. This podcast is probably a great example of that. Let's go do a podcast about Health Solutions, and okay, go do it, and having that autonomy to have those opportunities within the organization. One of the things that has been part of the culture with Health Solutions is Echelon Front, extreme ownership. And I know that is near and dear to your heart, Heather.
Absolutely. But all Echelon Front and extreme ownership did was really organize all of these different leadership cultures and principles into something that's really easy to communicate. So these aren't new ideas or new concepts. They've been around forever, but really hard to communicate in a simple way. So you can crosswalk Echelon Front's principles to any sort of leadership culture protocol that you want, and it will align. Again, they've just made it simple, and you gave us common language to talk about. And so this feeds into the culture too. So extreme ownership is all about how do you own everything in your life, in your personal and professional. So what happens is, as a team, an issue comes up, everybody at the table is coming to the table with their ownership. No, this was on me. I should have done X, Y, Z. Here's what I'm going to do to solve it. So when everybody comes to the table and is taking ownership versus, well, that was IT, or that was clinical, or that was so-and-so, and all the finger pointing, the finger pointing is back at us. And with that, we come with a solution, and that builds trust within, just to be humble and be transparent and come to the table with, I really should have done X, Y, Z, and here's what I'm going to do better, and here's what I learned from that. And so it really builds from within. And Echelon Front is all about everybody leads. Everybody here is a leader. And to your point, Melissa, this is a perfect example of this. Yeah. And I may get teary-eyed. You should have tissue in here. But this whole start was Nanci reaching out, who has done our suicide prevention, saying, hey, we are missing out here. And that was really where the Latinx community committee came from. And from that, here we are, talking about many different important things. And that's what's important, is everybody's a leader. If everything had to wait on Jason and I to bring it forward, I mean, we'd still be, decades behind. When we're all leading and moving forward and making decisions, that's what's going to really launch us forward.
In the July training that we had with all the staff, you talked about, this not being something extraordinary. These are typical things that we already do daily. And a lot of the staff from that I was sitting with said the exact same thing. They're like, this Echelon Front principle, there are already things that we're doing. We just didn't know that there was an actual name to it. So having that training was always like, oh, yeah, I am doing those things. Or, yeah, I can see that. And, it comes down to, like you said, having that ownership in ourselves and being able to be like, I'm human. I thought I did good, but I guess I didn't. But this is what I'm going to do going forward. And I think it puts that priority on us to be able to be the best that we can be, and just to also be able to grow with the company and be able to, to see what other exciting ideas we have.
Right.
Yeah.
And I think some leaders think that people will think less of them if they come and say, admit or humble, and I made a mistake,
Yeah.
that people are going to think less, but it's actually the opposite.
Yeah.
That if you're humble, people really respect that. And if my boss can own a mistake that they made, I can own those same things and trust that I'm going to be supported and not reprimanded. And I think that's huge.
Another thing, Heather, is that we found out that you recently spoke at the Women's Assembly for Echelon Front. How was that?
It was amazing. I was so proud to be asked to be a part of that. This was the third annual Women's Assembly that Echelon Front held in Arizona. When I first started with Extreme Ownership, when I first read the book, I started at home. I had multiple back surgeries, neck surgeries, and my last surgery, I woke up and I couldn't walk. I had no use of my leg. And so during that time, over months and using walkers and canes, I was able to walk again. But I used it as excuses for not working out, not taking care of myself. In that presentation, I said I had a reason for everything, a reason for eating pistachio ice cream every single night before bed, a reason for not exercising. I had a cadaver bone in my neck. I had plates and screws on my back, and I was diagnosed with diabetes. I was gaining weight. My health was going in a terrible way. And when I read this book, it was like lights went on, music started playing. It was like, if I don't take ownership of where I'm headed, I'm going to end up exactly where I'm headed, which isn't a good space. And just realizing that those were all reasons or excuses, and that I had to take ownership of what I'm doing, both personally and professionally. And so the next step after that was, okay, I've made these changes at home. How do I make these changes in the office? And I was very humble and came to the team and said, I haven't been the leader I want to be. And because I was guilty of too, also blaming, well, facility should have done this, or IT. And so I just put it out there. And when my team tells the story, they will tear up. And we'd worked together for many, many years. So the trust was there, but that set us on a whole different level.
Yeah.
So it was an honor to be able to present in front of hundreds of women from across different industries and just tell my story. And I've had a lot of people reach out and just say, thank you for sharing. This has really impacted, and here's where I am in my journey.
Yeah, absolutely. Well, I think that with the other thing with that comes with being in a leadership role is that you have that responsibility to have this appearance of like, everything is good.
Right.
Everything is going to be fine, right? So the fact that you were so vulnerable and be like, hey, I'm struggling. I've been this, and that, I think also showed your team like, oh, okay, all right, well, then I have some stuff as well too. And then being open to be able to be like, I don't have to have everything together.
Yeah.
I'm going to work towards that. But right now, I may not be there.
Right. We're all a work in progress, for sure.
Absolutely.
All a work in progress.
And I think that perpetuates the feelings of autonomy within the agency and organization, that like Heather's that vulnerable and like is saying, go lead, go do the things. And so it creates this culture within our entire agency of 500 plus employees now.
Yeah.
To say like, I can do this, make a decision and make a mistake, and it's not punitive. It's going to be something to learn from, something to grow from, which, like you said, helps us grow. And we have grown tremendously.
We have. It's amazing.
Heather, one thing that you would want our listeners to know, or a message you would want to send to our community regarding Health Solutions, what would that be?
We're here for you. We are here for you when you need us, where you need us. And we're not just behavioral health. We are a whole landscape of healthcare and wellness, and allowing our community to really thrive. So believing in us, and we're here for you when you need us.
Thank you so much, Heather, for being here with us and for giving us that background on Echelon Front, and for really sitting down with us and having this meaningful conversation. We like to end our episodes with having some, what I like to call them, spicy questions. And they're just
Oh.
rapid questions.
I didn't get a heads up on this one.
Rapid questions.
No pressure.
So the first question is, does pineapple go on pizza?
Yes, absolutely.
I raise an eyebrow to that. Question, Heather, is hot dog a sandwich?
Ooh. Hot dog is dog food.
We still haven't
No.
got a straight answer as to what a hot dog really is, to be
No,
honest.
True. It's dog food. That's what it is.
And the last question is, what is a mental health tip you live by?
Giving yourself grace.
That's a good one.
Giving yourself grace.
Love that.
Yeah, that's a good one. That's a good one.
Thank you for being here with us today, Heather.
Thank
We
you. This was
appreciate
great.
you taking time out of your busy day. I know you've been on the road and, doing all the things. So we are so happy to have you. And I think our listeners appreciate hearing your insights about Echelon Front and what Health Solutions has to offer. So we are so proud to be part of this, and we appreciate you.
Thank you. Thanks
Thank
for
you.
having me.
Absolutely.
Again, this is Talking Health with Health Solutions. If you or someone you know is struggling with a mental health crisis, please don't hesitate to reach out to 988. You can also walk into our crisis walk-in center at 1310 Chinook Lane, and you can also contact us directly at 719-545-2746. Appreciate all of you, and until next time, Talking Health with Health Solutions.